Clinical Conversations on the Smart Chiropractor Show. Today, we are highlighting an Axis 2021 presentation from Dr. Gerry Clum. This is titled Spontaneous Intracranial Hypotension. I wanted to look down and make sure I get that correct. And this was a fantastic presentation. We were super fortunate to have Dr. Clum come in and teach during Axis 2021. We are also looking forward to Axis 2022. So be on the lookout over the coming weeks and months as we start to announce the details around Axis 2022. What is Axis? Well, if you are new, Axis is our yearly clinical seminar that takes place online. We draw together some of the best minds in and around chiropractic to talk clinical, and today is no exception. So without further ado, let's click over and check out an Axis 2021 presentation. We're going to do a little teaser of it. Spontaneous intracranial hypotension. Here we go.
Good afternoon. My name is Dr. Gerry Clum, and it's my pleasure to be with you this afternoon. And I'd like to thank Dr. Jason Deitch and Dr. Jeff Langmaid of the Smart Chiropractor for the opportunity to present at this year's Axis Clinical Conference. I'm very honored to be with you today and look forward to spending the next 35 or 40 minutes together to share some information that I think is important to you and might be useful to you and to perhaps some of your patients down the road. For the past 20, almost 25 years, I have been involved in the general category of risk management in chiropractic. I've been focused predominantly on CVA issues relative to cervical spine adjusting and vertebral artery issues. And along the way, have spent a good bit of time representing chiropractors in litigation and in pre-litigation activities. And along the way, I've developed several areas of interest based upon things that I've seen come across my desk and cases that I've been asked to comment upon. And I'd like to chat with you about one of those areas today, and that is the area of what's known as spontaneous intracranial hypotension, which is associated most commonly with dural leaks, which has a tendency to produce a very characteristic postural headache. Let me just jump right into my slides here. So we'd like to take, as I said, the next 35 minutes or so and review with you this general subject matter of spontaneous intracranial hypotension. Now, for many of you, this will be very much a review and things that you're very familiar with. And as I'm going through this, some of the elements that I'll be talking about will be well known to you and very obvious to you, and others might be new, and the context that that I put them together might be helpful to you. So please understand that my goal here is to help better prepare you for your work and your function as a chiropractor in certain specific cases that might be associated with spontaneous intracranial hypotension. A little bit more in terms of my background. I told you about my activities relative to risk management. But from 1981 through 2011, I had the good fortune to serve as president of Life Chiropractic College West. From 2011 to today, I currently hold the honorary position of president emeritus at Life Chiropractic College West. In 2011, I joined the faculty again of Life University, where I started my career in the initial faculty at Life Chiropractic College in Marietta. And coming back to that faculty in 2011, I accepted a position as the director of the Octagon at Life University. And it's been my good fortune to continue to work in that area for the last 10, 11 years or so. So let me jump right into the content here if we can. So let's talk about why we bother with this first and foremost. Well, spontaneous intracranial hypotension, which again results predominantly from dural leaks, has been associated with symptoms that are commonly seen by chiropractors, in particular neck pain, headache, and sensory disturbances. Beginning in 2000, a series of case reports has been published, some suggesting, some asserting, and some stating outright that chiropractic care can be a cause of dural leaks that in turn yield spontaneous intracranial hypotension. And as a result, the potential for allegations of malpractice or falling below the standard of care in general associated with these types of problems and headaches has come to the table. Obviously, knowing which patients to immediately refer, which patients to co-manage with a neurologist or a leak specialist, or which cases you can manage on your own as a chiropractor, will be very helpful to you as well as to your patients. Spontaneous intracranial hypotension is predominantly caused by dural leaks in the spine. Now, the leaking of the cerebrospinal fluid from the dura causes the buoyancy of the brain to be lost or lessened at least, and it yields the sagging of the brain and the skull. This obviously stresses the elements of the lower portions of the brain, and putting traction upon them and causing a wide variety of symptoms. The classic presentation is involved as a postural headache that resolves in recumbency and worsens when upright. Now, to go back a little bit more in terms of background on the dural sac, as you remember, is a watertight membrane. And within the dural membrane, cerebrospinal fluid circulates. And it's this circulation and the maintenance of the circulation that maintains the floating environment of the brain within the skull cavity. The dura of the cranial vault is continuous with the dura of the spinal canal, and the dura extends in the form of dural sleeves as a covering as a covering membrane for the spinal nerves to the area of the dorsal ganglion. This happens by way of penetrating the dural sac in an infralateral direction and takes with the nerve, an extension of the dura mater and the arachnoid mater. So you can begin to see why some persons who are concerned about dural leaks might say that something that we do in terms of rotary motions of the neck or mechanical input that we offer in terms of the process of adjusting could have the ability to influence this dural covering. Now, I'm not saying that it does. I'm just saying that that's the reasoning that's been applied by some persons in healthcare asserting a relationship. Now, this causes of spontaneous intracranial hypotension have been categorized into two major categories, primary and secondary. Primary are spontaneous in nature. Generally, there isn't a specific cause. The overall causative element or moment is unknown. It's associated with a weakness in the dural sac. That may be complicated by trauma, but it begins with a weakness in the dural sac, and it may be reflected in such things as meningeal diverticula or a connective tissue disorder, conditions such as Marfan's, for example. The secondary causes or classification of dural leaks are associated with definite trauma, such as a whiplash injury, such as a degenerative spinal disorder, a spur that digs into and cuts the dura, or the result of a surgical procedure, something as simple as a spinal tap or something as significant as an overdraining CSF shunt, so on. Any of these conditions can produce this dural leak environment that in turn produces the characteristic headache that I was speaking about. This was first identified in 1898, and dural leaks at that time, based upon the imaging and the understanding of neurology that was available, they were thought to be spontaneous and idiopathic. Well, in the last couple decades in particular, most specifically in the last decade, we now understand with the imaging that we have available to us is that there's really three primary areas where this pathology arises. And that has to do with the discogenic pathology, such as the spur that I made reference to before. It cuts into the dura, or a connective tissue disorder associated with Marfan's, or a spinal drainage problem in general, structural problem. Now, in terms of the causation, clearly the most common origin of this problem is that associated with lumbar puncture. The number of persons with CSF shunts is a pretty limited category, and then the number of those shunts that overdrain is obviously an even less likely opportunity. Myelography is a relatively common experience and evaluation. Spinal anesthesia, similarly, and cranial spinal surgery isn't that common, but again, can be an important area where this can arise. The thing we need to keep in mind is that none of those areas are things that we're going to be involved in directly clinically. But these types of problems, dural leaks, can develop with small insults, even something as simple as a Valsalva maneuver. And when it does occur in conjunction with a Valsalva maneuver, for example, it's generally associated with a weakness of the thecal sac of some congenital or acquired origin. Activities of daily life, such as coughing, sneezing, physical activities such as heavy lifting have been associated with the onset of spontaneous intracranial hypotension related to a dural leak. So while we have very dramatic origins with craniospinal surgery, we have very common everyday origins such as a cough or a sneeze that can generate this problem. And again, we obviously do something to the neck and the spine, I should say, more generally. We put forces into the spine. And the argument is, again, been put forward, the idea that if we're putting a force into the spine, that we have the potential to alter the dynamics and the fluid dynamics of the dural system and have the potential to produce a tear or aggravate a tear. Again, I'm not asserting that that's the case. I'm just telling you that that's part of the rationale for the authors from within medicine that have spoken about chiropractic being a factor in these areas.
Right. That was a presentation from Dr. Gerry Clum at Axis 2021. That is, I mean, that presentation gets real because it dives deep into the science. I don't know actually anybody out there that has the depth of knowledge he does around that topic. I am super grateful, Jason, you put it together to have him as a guest, and 2021 Axis was awesome. 2022, I don't know. We're hoping it's going to at least meet the expectations, but 2021 was fantastic, and Dr. Clum put together a fantastic presentation. Any thoughts?
You know, it's wonderful to have such geniuses in our profession. Besides being the past president or past president of Life Chiropractic College West. He's been a mentor to many, and his mind and the way he's able to both understand the science of what we do as well as the philosophy of what we do and his ability to integrate the two, I think has just been game changing for the profession. I'm grateful for his both friendship and leadership for so many decades.
Very well said. That was our clinical conversation on today's Smart Chiropractor show. Again, be on the lookout for details around Axis 2022. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.